Hi everyone, I am Jiajie Zhang, Dean of the School of Biomedical Informatics at the University of Texas Health Science Center at Houston. Our school is one of the largest academic programs of biomedical informatics in the nation, and the only one as a freestanding school. We are located in the Texas Medical Center, the largest healthcare cluster in the world. At our school, we do education, research, and application in medical AI and data science, clinical and health informatics, and bioinformatics and systems medicine. Today, I talk about artificial intelligence applications in medicine. I want to tell you why AI is to medicine today what the X-ray was to medicine a century ago, and much more. Here are the subtopics that I will cover today. Medical AI is the X-ray of the 21st century. Medical AI is finally here and for real. Medical AI is easy, which is scary, but medical AI is still very hard. Finally, I will explain why the success of medical AI requires deep clinical integration. Medical AI is the X-ray of the 21st century. A century ago, X-ray enabled doctors to see invisible structures inside the body. Today, AI is enabling doctors to not only see but predict previously unidentified patterns within massive medical and biological data. This is a futuristic picture of what medicine in the high-tech world looks like. The key physiological states of the body are patterns of data that are intuitively visible, easily actionable, with the touch of a finger. The data are dynamic, can go down to molecule level, and can go up to population level. The data can also go back in medical history or go forward as predictions of health status of the patient. Diagnosis can be made and treatment plans can be generated with the help of artificial intelligence. Artificial intelligence, since its beginning in the 1950s, promised a lot of things, but nothing really worked, including expert systems for medicine, which was a big part of early AI. Today, three drivers made AI a reality and capable of solving real-world problems, sometimes better and faster than people. These three drivers are massive data in electronic and computable forms, powerful and affordable computing, and universal connectivity. Let's take a look at what happened over the past 5 to 10 years. The amount of data are increasing exponentially. For medicine, the adoption of electronic health records, or EHR, is almost universal. The cost of sequencing the entire human genome dropped from the cost of a Boeing 737 to the cost of a smartphone. Of course, the speed of internet connection and the speed of computing are both massively increased. Whether you talk about Industry 4.0 or Healthcare 2.0, We are at a historically unique moment, the cognitive revolution, that is liberating people from the cognitive labor. This is as fundamental as the Industrial Revolution that started more than 200 years ago, that liberated people from physical labor, or the Agricultural Revolution more than 10,000 years ago that provided people with food security through the transformation from hunting and food gathering to farming. U.S. Senator Ben Sasse summarized the moment we are in today very nicely in an article in the Wall Street Journal. The past 20 or 30 years, and the next 20 or 30 years, really is historically unique. It is arguably the largest economic disruption in recorded human history. Computing technology has transformed, or has been transforming, all major industries, from information access, communication, to retail, entertainment, to travel, finance, and to knowledge-rich education. Today is finally getting into the healthcare industry, fundamentally transforming how we treat patients, how we make diagnoses, how we prevent diseases, and how we make biomedical discoveries. The list of medical AI applications is expanding rapidly. Imaging segmentation, imaging annotation, and imaging-based diagnosis are becoming the early playground of AI applications. Prediction is one of the major strengths of machine learning. Examples include the prediction of sepsis onset before it is detected by regular algorithms, predicting disease progression, calculating risks for various medical conditions such as myocardial infarction and heart failure, discover computational biomarkers to detect medical conditions such as Parkinson's from typing on a keyboard. Of course, natural language processing is a very active application area for AI. Medical AI systems can even take a medical licensing exam, performing better than 80% or more than human takers. The list goes on, and the potential is unlimited. Let's take a look at a few examples of medical AI applications that are developed by the researchers at our School of Biomedical Informatics at the University of Texas Health Science Center at Houston. Developing a new drug typically takes more than 10 years and costs more than $1 billion US. If an approved drug on the market for one disease has functions that can be potentially used to treat a different disease, that is, repurposing an existing drug, it will benefit the patients and the medical community. Medical AI can help with discovering the signal for a new disease through data mining of massive medical records. Dr. Hua Xu, through the use of natural language processing and data mining over millions of patients' records, discovered that metformin, which is one of the frontline drugs for type 2 diabetes, has a potential impact on cancer treatment. He compared cancer patients who are either diabetic or not diabetic, whether they use metformin or other diabetic drugs. and discovered that diabetic cancer patients who took metformin for diabetes had a much better 5-year survival rate than diabetic cancer patients who took other diabetic drugs, and even the cancer patients who are not diabetic. This type of discovery is only possible with the availability of massive patient records and the use of advanced AI tools. If you have the medical records of 15 million people for over 10 years, what can you do with it? Absolutely a lot. Dr. Jiajie used this type of dataset from the Thurner Corporation to predict the risk of heart failure onset. Heart failure is a medical condition where the heart can't pump enough blood to meet the body's needs and eventually lead to death. In 2016, there are 5 million heart failure patients in US, and healthcare costs for them was over $30 billion. Early prediction and early prevention and treatment is the key to taking care of these patients. Dr. Zhi and his team used a deep recurrent neural network to develop a predictive model that performed really well, with an AUC around 79 to 85%. Dr. Luca Giancarlo developed a machine learning model to identify computational biomarkers from the movement of the hands in typing on the keyboard or touching on a smart device. He was able to use the signal to identify whether a patient has Parkinson's disease or not. This is a potentially very useful tool to do early detection and for tracking of progression of Parkinson's disease. Sepsis is the bacterial infection of the bloodstream. It is the leading cause of death in US hospitals. One patient dies every 2 minutes in the US, more than breast cancer, prostate cancer, and HIV combined. The good news is that 80% of sepsis deaths are preventable. Mortality increases 8% for every hour that treatment is delayed. So early detection of onset of sepsis, or better yet, early prediction well before it can be detected by the current standard of care algorithms, is going to save a lot of lives. Dr. Jiajie Zhang, a machine learning researcher, collaborated with Dr. Bella Patel, an ICU physician, and Dr. Robert Murphy, an ER physician. They developed a machine learning algorithm based on deep LSTM that can predict onset of severe sepsis 4 hours ahead of time. The AUC of the model achieved 92%, better than the status quo of 85% achieved by other models. Their model is currently being validated for potential deployment at our teaching hospital, Lamar Herman Hospital at the Texas Medical Center. The eyes are the windows of the soul, as we often hear. For medical AI researchers, such as Dr. Luca Giancarlo and his physician collaborator, Dr. Sunil Seth, the eyes are the windows of health. Retinal images are typically used to diagnose eye diseases. However, they are actively developing the AI system that can use the retinal image to detect signs of stroke. CT imaging is the standard of practice for stroke diagnosis. In comparison with CT machines, which are very expensive and not mobile, the device for taking retinal images is very small, portable, and inexpensive. The AI technology of using retinal images to diagnose stroke and other medical conditions has a lot of potential. With the development and refinement of many high-level machine learning packages, such as TensorFlow, Trax, and PyTorch, developing medical AI applications is becoming incredibly fast and easy. With unlimited coffee and food, students, both undergraduate and graduate, can develop machine learning algorithms that can solve real-world medical problems within 24 hours. Let me show you a few hackathons and datathons that our school has organized and hosted under the leadership of Dr. Jiajie Zhang, Jiajie Zhang, and Jiajie Zhang. In this datathon in 2019, the students were given the task of predicting sudden unexpected death in epilepsy, or SUDEP. For epilepsy patients, after seizure, there is a chance of dying, and this is indicated by the onset of slow activity of their EEG signals. The students were given the EEG data of real patients and asked to build a machine learning model to predict the onset of the slow wave. The best model from the students achieved an AUC of 84%, which is quite good. The student project from the hackathon led to 5 publications in a BMC special issue, another amazing achievement by the students. Just like many people in the nation and in the world, when the COVID-19 pandemic hit, we tried to help to deal with the pandemic with our own expertise. We organized a student COVID-19 datathon. The task is to predict COVID-19 hospitalization and mortality in the greater Houston metro area. The students were given data about the historical hospitalization and mortality rates, the infection, recovery, active, and test cases of COVID-19 across 9 counties, and the population mobility, demographics, and mask use. The best model's performance achieved a mean square logarithmic error of 16.5, which is quite good. In the most recent datathon we hosted last month, the students were asked to build a machine learning model to predict how well a stroke patient recovers over time. Specifically, the students need to develop algorithms to predict changes in cognitive and functional independence measure scores. Again, the models the student developed performed well. Solving a real-world medical problem with real patient data, especially within 24 hours, by undergrads and grads, some of whom only learned the basics from an Intro to Machine Learning course. This is very exciting, but think about it, it is also kind of scary. Having a model that makes good predictions, however, does not mean that it can make an impact on the patients in the real life. Medical AI is still very hard. Most academic, as well as industrial, medical AI products never get deployed. There are many reasons. After research and development, and after validation, both internally and externally, a medical AI product is ready for testing in a real clinical setting. However, how to get the product into the production environment is one challenge. How to get it into the clinician's workflow is another bigger challenge. What are the clinical and business utilities of the product? How to get it to go through the regulatory process both internally and externally, such as FDA. How to keep the product updated with new data, modified with new algorithms. How about patient safety concerns? The list goes on and on. Let's look at a real use case to understand the complexity of getting a medical AI product into the clinical setting in real life. This case is about CT imaging for stroke. There are two types of stroke. Ischemic stroke, that is the blockage of the blood vessel, and the hemorrhagic stroke, that is the breakage of the blood vessel. Ischemic stroke accounts for 87% of stroke, and there is a therapy that can save a patient's life. This therapy is called endovascular stroke therapy, or EST, which is to insert a stent retrieval from the groin all the way to the brain to remove the blood clot. CT perfusion, or CTP, is the definitive guide to determine whether a patient is eligible for this procedure. CTP is an advanced procedure that is not widely available at smaller facilities. A relatively simpler technique called CT angiogram, or CTA, is more widely available, but it is typically not good enough to determine EST eligibility. Dr. Giancarlo, with collaboration with neurologist Dr. Schiss and Dr. Savis, developed a machine learning model that can use CT angiogram to do what CT perfusion's job. They successfully developed a CT angiogram-based AI system called Deep SimLab, which has a very good performance level. This system reduced the time from patient ER arrival to treatment decision dramatically, because the AI system only takes 1 minute to read the CT and send the report to the physicians for treatment decisions. The system generates an alert after image analysis by the AI system and sends it to the stroke team by email that has an EST eligibility score along with the CT images. The development and implementation of this system recorded very fast bench-to-bedside time. It took a year to go from idea to implementation in the hospital, and this is very fast. The pipeline for this system is now integrated in 4 hospitals, and it is functioning in near real time. As we can see, this AI pipeline sends an alert by email, which is outside of the EHR platform. Getting this system integrated into the EHR platform and the workflow of the clinicians will be the next step, which is non-trivial and may very well be the major barrier for its wide adoption. A technically capable AI product needs to be deeply integrated into the clinical environment, and it needs to show its clinical, operational, and financial utilities before it can be widely adopted to generate meaningful impact on patient care. This deep integration requires a lot more than AI algorithms. It requires an entire discipline called Biomedical Informatics, and it requires an insider's job, that is, researchers and clinicians in healthcare institutions. Biomedical informatics studies the acquisition, storage, communication, processing, integration, analysis, mining, retrieval, interpretation, and presentation of data, and determines how to transform data, which are meaningless symbols, to information, which are interpreted data, to knowledge, which are validated information, and to intelligence, which are actionable knowledge, with the aim of solving problems in disease prevention, healthcare delivery, and biomedical discovery. Biomedical informatics covers the entire spectrum of biological scales, from small molecules, genes, proteins, and cells, to tissues and organs, to individuals and populations. Biomedical informatics is a highly interdisciplinary field focused on collaborations with partners in clinical practice, such as medicine, nursing, dentistry, and pharmacy, the biomedical sciences, public and community health, computer science and engineering, mathematics and statistics, cognitive science, social and behavioral sciences, healthcare management, and health IT policy and law. Data science for medicine is a subfield of biomedical informatics. It focuses on all aspects of data for disease prevention, healthcare delivery, and biomedical discovery. Medical AI is in turn a subfield of health data science. It focuses on machine learning, pattern recognition, computational phenotyping, and predictive modeling. Our School of Biomedical Informatics at the University of Texas Health Science Center at Houston is the only freestanding school among 70 or so such programs in the nation, and it is one of the largest internationally. The AI revolution promises to be an exciting era. With virtually unlimited potential, medical AI is rapidly evolving to produce ever greater numbers of increasingly advanced clinical applications that will dramatically improve patient care, disease prevention, and biomedical discovery. We are proud to be a leader in medical AI, health data science, and biomedical informatics. It's great to be part of that transformation. Thank you for your time. Hope you enjoyed this presentation. If you want to learn more about medical AI, health data science, biomedical informatics, or the education programs at our school, you can reach me by email or follow me in social media. Thank you so much.